Hi everyone, welcome to week 11 in Foundations of Nursing. So as promised, I'm recording this lecture in place of the lecture we would have had today since you guys are going to be presenting your Healthy People 2020 projects. And this lecture actually is a good complement to your Healthy People 2020 projects. We're going to talk about providing care in the home and the community. So we're going to talk a little bit about the different roles of a community-based nurse, a public health nurse, and a home health nurse. Kind of look at the differences, kind of compare those to a nurse in the acute care setting. So here we go with the lecture. So the objectives for today's lecture is basically I just want to be able to have you describe the goal and the role of the public health nurse, the community health or the community-based nurse, and then the home health nurse. So again, in the beginning of my lectures, I always like to talk about some of the challenges and opportunities that we can be presented with as nurses in each of the lectures that we talk about, each of the topics. So some of the challenges and opportunities for community health nursing is as nurses, we want to be able to provide safe and effective nursing care for all. And we'll see through public health, through community-based nursing, we can try to do that with our patients. We can try to reach out to those who can't get to clinics, who can't get to their appointments, who can't get to a hospital, and provide that safe, effective care. We want to be able to provide an important link to healthcare knowledge and services by giving care to patients in their home or their community. And if we can keep patients at home, we can better their care. We can improve health outcomes. Patients who are taken care of in their home are going to feel better about themselves. They're going to follow their regimen better for the most part. They're going to, be happier and healthier overall because they're staying in their home versus in an unfamiliar hospital setting. We have some opportunities to reach remote areas, like I just talked about, that have or don't have technology, and we can form new partnerships within communities. Some more challenges and opportunities. There's an increase in delivery of nursing services in the home and in the community. And we talked a little bit about these in our Healthy People 2020 lecture. And this is going to be due to change in demographics. It's going to be due to the rising healthcare costs. Again, keeping a patient in their home and providing care in their home can be much more cost effective than keeping a patient in the hospital setting. We talk about that emphasis on health promotion and disease and injury prevention. Again, I said I'm going to mention this over and over and over again in the class, and that is the emphasis on healthcare is now in the community setting, the outpatient setting, and it focuses on disease prevention, health promotion. And we're trying to get away from that acute patient inpatient setting. Managing chronic stress and disease, and we want to enhance quality of life. So when we're talking about community health nursing itself is an umbrella term. So basically it's the role of the public health nurse, the community-based nurse, and the home health nurse can all be categorized under community health nurse. But there are some subtle differences. Some people use them interchangeably. But there are some subtle differences which I'm going to talk about in this lecture. But whether you're a public health nurse, a home health nurse, or a community-based nurse, there's different roles that you are going to provide to your patients in the public. And that would be care provider, client advocate, case manager, change agent, educator, collaborator, counsel, and epidemiologist. And we're going to talk briefly a little bit about each of those. So the care provider role. So when you think about a care provider, you think of somebody who, essentially cares for someone else. So as the care provider, we're going to be developing caring partnerships and recognizing actual and potential healthcare needs of our clients within the community. We're going to identify community resources that are needed for our clients, and then we're also going to build healthy communities that are safe and allow our patients to achieve and maintain high quality of care. So that's what we mean when we say a care provider. So developing those partnerships and identifying those resources that our patients in the community needs, and then also building those healthy communities. Client advocate, we talked about advocacy when we talked about our legal ethicals in our legal ethical chapter. So being a client advocate is clarifying what services are available to our patients in the community setting. It's providing necessary information to our patients to help them make the decisions that are important to them and that are right for them. And then they can choose those services appropriately as they see necessary. And we also want to be able to support our patients' decisions. That's advocating for our patients. And again, that's in any setting, inpatient, outpatient, community. We always want to be patient advocates. A case manager. We talked a lot about case management in a couple of the different lectures that we have. So again, case management is coordination of care. It is linking patients with the needed resources and services within the community that they need. And then community-based managers usually will assume responsibility for multiple patients. So unlike in the hospital when you're working one-on-one with a patient, sometimes it's with large groups of patients in the community setting, but they're very, very important because they're helping to link our patients to the appropriate resources. So whenever you see the word case manager, you think of coordination of care or linking patient to resources. Then we have a change agent, and we talked about managing change, and we talked about change agents, and most likely in the healthcare setting, that's going to be your leaders and your managers that are making these changes. And a change agent in the community, you as a nurse could be a change agent for your client. And this is identifying and implementing new and effective approaches to a problem. It's helping your patient identify what the problems are in the community, and it's also, helping them solve those problems. What can we do as a community-based nurse, a public health nurse, a home health nurse, to solve key problems in a community? And some of the problems that you might run across as a community-based nurse or a public health nurse is maybe quality of community childcare services. You might see the problem with the availability of older adult daycares. You could see a problem with the status of neighborhood violence. And an example I gave is determining why a patient has difficulty keeping their regular healthcare visits. Is it a matter of the distance? They can't get there. Is it a matter of the hours of the clinic that they go to? So identifying a problem and helping advocate for the patient by being a change agent. Let's solve the problem for our patients. The public health nurse or community-based nurse as an educator, obviously home health nurse as well. So we can obviously be educators in any healthcare setting that we are working in, whether it be, again, clinic, hospital, community-based. So we're providing education to our patients in their home, in the community. And again, examples I gave may be prenatal classes, they might be infant care classes, child safety classes, cancer screenings, going into a patient home and providing diabetic education, medication teaching. So we can be educators of every kind when it comes to being a nurse, and especially in that community-based role. Collaborator, we talked about collaboration quite a bit. That was one of our nursing roles, and it certainly applies to the community-based nurse and the public health nurse. Collaboration, again, is working with other healthcare disciplines to provide the best care to our patients. So an example in the community health setting would be a patient who's discharged home with a diagnosis of cancer, and that nurse is going to collaborate with the hospice staff, with other social workers, with pastoral care, with the patient's physician. So we're going to collaborate with pharmacy, everybody. We're going to work together when that patient is discharged home. So just because they're home doesn't mean we stop collaborating. And again, collaboration is effective when we have mutual trust and respect between each discipline. The nurse is the counselor. So nurses are counselors, again, in every setting. So the counselor's role is to help patients identify and clarify health problems, choose appropriate courses of actions. Examples in the community would be working in a women's shelter or an employee assistance program within the community. We're going to be able to provide our patients with information. We're going to listen to them objectively. We're going to be supportive, and we're going to develop that trusting and caring relationship that our patients need from us. And finally, the last role, the nurse in the community as an epidemiologist. And this role, a lot of times you will see linked to the public health nurse. This is tracking incidents of illness, the rates of illness, also providing health teaching. An example I gave is finding new TB exposures or tracking incidents of elevated lead levels in children. Excuse me. Again, we just have that, I think it's still ongoing, that issue within Milwaukee where those children who had high lead levels were not being followed up and there was nothing being done about, where were they coming in contact with this lead. So epidemiologists, that's going to be more specific to the public health nurse role, which we'll talk about in a few minutes, but definitely an important part of being a community health nurse. So let's first of all, when we talk about the different roles, under community health, again, that's a big umbrella term. First, we're going to talk about community-based nursing. So community-based nursing focuses on individuals, groups, might be groups and families within a specific community. And the goal in community-based nursing is to protect, promote, and maintain health. So when we talk about community-based nursing, a key term that you're going to want to remember is subpopulations. So as a nurse, a community-based nurse, you are going to be providing care to subpopulations in a community. And some examples of subpopulations might be elderly, could be males, females, infants, adolescents, specific cultural groups, that is what we call a subpopulation. So remember that word when you hear community-based nursing. Some examples of community-based nursing could be home health agencies, could be community health centers, could be clinics for screenings, referrals, and health education, could be churches, could be occupational health settings, homeless shelters, nursing homes. Those would all be examples of care we could provide within a community. So also another important term when we talk about community health nursing is the word aggregate. And some of you may or may not be familiar with that term. So if you become a community health nurse, again, public health, community-based, you're going to be working with what we call aggregates. And those are groups of patients that a community health care nurse that we care for, that the community health nurse would care for. So remember that word is aggregate. So these groups of people have similar social, personal, and healthcare needs. But that is another term I want you to be familiar with is the word aggregate. So a group of patients that a community health nurse is going to care for. Then we want to talk a little bit about public health. Public health nursing is distinguished by population focused. So community-based, we go into the communities. Public health, we're focusing on populations. So a collection of individuals who have one or more personal or environmental characteristics in common. And again, it's prevention focused. We want to talk about health maintenance. And public health nurses are the ones who are going to use politics, political process, grassroots to affect public policy. So they really get involved with the government. They really get involved with politics. So you think of the public health nurse, you think of advocating at the political level. So some examples of public health nurses you could see would be school nurses, addictions nurses, correctional nurses, nurses that work for public health departments. And we talked about the nurse as the epidemiologist, that role of the epidemiologist specific to public health. So they can work to reduce incidence of infectious diseases such as TB, HIV, AIDS, health issues such as obesity. But again, public, if you think of PP, public population, community-based is communities, okay? So, and then again, some examples, school nurses, addictions nurses, public nurses that work in public health departments. So those are all examples. The next slide here, I have a video, and it's from Johnson & Johnson. It's a really good video about a public health nurse. She's a school nurse. So please watch that at your own time. It's just a few minutes long, but it gives you a really good insight into what a school nurse does, a public health nurse would do. for patients. Then the home health nurse, and home health nurses are wonderful people, and um, there's another slide I'll talk about with like hospice and palliative care. But first of all, defining home health. Home health nurse is distinguished by what we call individual episodic care. And what does that mean? So basically, a nurse is going to go in and they have short-term goals and outcomes that they have for a patient in their home. It's very individualized. It's per episode. So let's say a patient is discharged home, they just had surgery, they have to have dressing changes daily to the surgical site. Again, that's an individual episode, the surgery. So again, individualized episodic care, short-term outcomes. We're going to go in, we're going to do the dressing changes for an X amount of time, and we're going to leave their home. Teach them how to do it, or when they no longer need our services. So again, that's what we mean by individualized and episodic care. Requires high technology skills by the nurse. A lot of times you're using their iPads, Chromebooks, whatever it may be, but there's a lot of technology to keep in communication with the physicians, charting, that type of thing. Some factors that have contributed to the growth of home health care, again, increase in our older population. So we're sending our older adults home from the hospital, and a lot of them are going to need follow-up care in the home. Again, whether it be dressing changes, medication management, teaching, they're going to need that follow-up care. Again, insurance companies or third-party payers favor home care to control costs. Again, it can be a lot less to be treated in your home, or cost a lot less to be treated in your home versus staying in an acute care setting such as a hospital. We have the ability to provide high technology services in the home, and consumers prefer their home environment. I talked a little bit about that in one of our first slides. Patients want to be home. They don't want to be in the hospital. They want to be home where they can be cared for. They feel more comfortable, and it also promotes healing. So some definitions of a home health nurse. You'll also hear home nursing called home health nursing, home care nursing, visiting nursing. Those are all examples of a home health nurse. So they encompass a wide range of health services delivered at home and throughout the community. So nurses can provide nursing in the patient's home. They can go to long-term care facilities, residential hospices, shelters, anywhere where somebody calls that place their home. That's a home health nurse. They work primarily with ill clients, but they work as a member of a multidisciplinary team. Again, collaboration. And home health nursing is very family-centered. If any of you ever had a family member who might have had a home health nurse come in, whether it be to give an IV antibiotic temporarily, whether it be hospice care for a patient, until they passed on. Home health nurses are very wonderful. They're a very intricate part of the multidisciplinary team when it comes to treating patients in their homes. So here's a slide on hospice and palliative care. Definitely considered a subspecialty of home health nursing. So hospice care and palliative care, they're a little bit different in the sense that hospice care is when patients have a terminal illness that they are diagnosed with, and they have been deemed by their physician to have 6 months or less to live. Then they will qualify for hospice care. Palliative care starts from the beginning of a terminal diagnosis. Sometimes these chronic diagnoses that patients are diagnosed with, such as chronic lung disease, chronic heart disease, it may be years before the patient passes on. Being in the pulmonary department that I worked for 10.5 years for Froedtert, we would see a patient diagnosed with COPD, which is chronic obstructive pulmonary disease, and it may be 10 years later down the road that they finally passed on. So a hospice is only part of that palliative care. It's the last part of palliative care. But palliative care starts at diagnosis, and it follows the patient all through until they reach that hospice phase, and then finally until they have passed on. So very, very supportive nurses, very caring nurses. And they also provide pain and symptom management. They support the family. Very, very knowledgeable in their area of hospice. They are available 24 hours a day. Somebody will be on call to come into the home if the patient and their family needs them. Very special people. It is a very wonderful aspect of nursing. Again, some advantages of being treated in your home. Again, it's convenience. Patients don't have to leave. Access to care. They get the access right in their home. Information that can be brought to them. Teaching. And then again, that nurse's role as a teacher. Relationship-centered care. Cost-effective. And we are helping the patient meet their outcomes better by being treated in their home. They can reach their goals. So the differences between home health nursing and hospital nursing. I wanted to throw this in because there are a lot of differences when it comes to home health nursing. So as a home health nurse, you are a guest in that client's home environment. Whereas if you work in the acute care setting, that's your job. A lot of these people are guests in the hospital or are patients in the hospital. But we are guests in their home. We have to respect their environment. Home health nurses have to be very knowledgeable about reimbursement systems, reimbursement issues, whereas like acute care setting usually have people that are doing that for you, and the home health nurse has to be knowledgeable about that. Very much high autonomy in the home health setting. You work alone a lot. You have to be able to make decisions on your own, although you do have that multidisciplinary team that you can collaborate with if needed. You're more at risk for malpractice claims because again, you're more on your own. You're in, outside of the acute care hospital setting. You may have minimal supplies and equipment to work with. I think home health nurses are wonderful at improvising if needed. And you need to have a really good knowledge base of community resources that are available. So again, here's another video that I've uploaded for you guys to watch at your leisure. Again, I really do encourage you to watch these videos. Don't skip through them. They really do add a lot to the video. This is about a home health nurse and her job in going into the home, into the communities, and helping to care for patients. So it gives you a really good insight on what a home health care nurse does. I'm going to throw out a couple of a couple of terms when it comes to home health nursing, community health nursing. First term is what we call a vulnerable population. A vulnerable population are groups of patients that are more likely to develop health problems as a result of excessive health risks. So these are people that we really want to try and focus on because they're very vulnerable. They're more likely to develop these health disease or these health problems and these health risks. They're usually dependent on others for care. They have limited access to healthcare services such as health disparities or social determinants of health, like we talked about in our Healthy People 2020 lecture. So examples of these vulnerable populations may be individuals living in poverty, the homeless, older adults, immigrant populations, individuals in abusive relationships, substance abusers, people with mental illness. Again, I truly believe that mental illness is very underserved. We need a lot of advocating for our mental health patients. So we would consider them a vulnerable population. So again, people who are likely to develop health problems as a result of excess health risks. When we talk about the vulnerable populations, again, one of the examples I gave was older adults. And, older adults, again, I talked briefly about this in previous lectures, how we have to look at the fact that we are going to have an older adult population that we are going to be serving as nurses, which brings on increased healthcare costs, which brings more chronic conditions, patients living a lot longer. Some of the major health problems that we see in older adults are chronic conditions. We see a lot of cancer, hypertension, arthritis, diabetes. We see a lot of visual impairment, cognitive impairment, Alzheimer's disease. Older adults can have dental problems, believe it or not, substance abuse and alcohol abuse, and then certainly financial difficulties. These are some of the major health problems you'll see in our older adult population. Financial difficulties, certainly when you're on a fixed income, and you're not getting a lot of money each month because you no longer work and you're on Social Security or disability or Medicare, whatever it may be, you have to pay for your prescriptions, your doctor's visits. So there's a lot of financial difficulties for our elderly patients. And then I'd like to talk a little bit about a community assessment. So as a community health nurse, whether it be public health or community-based nurse, home health nurse, we're going to be doing something called a community assessment. Now later in the nursing curriculum, towards the end, one of your last semesters, you will be taking a community nursing course. So I only wanted to give you the basics in this course. One of the things you might be doing is called a windshield survey, where you get into your car and you drive around the area you're working in, and you see where's the populations or the community's access to health care. Where are their clinics? Where are their dental offices? Do their grocery stores, are there grocery stores close by? What kind of foods do they stock in those grocery stores? Do people have access to healthy food, healthy, sanitation, healthy water? So that's kind of what we do with a windshield survey, and it's actually kind of fun. I did one when I was at UW Oshkosh, where I had my partner and we drove around the town called Winneconne, which is up near Oshkosh. And we got to get out of the car, look at the grocery stores, what clinics were nearby, is it a touristy town, which Winneconne certainly was. So it was really, really interesting to see from that viewpoint. So they call that a windshield survey. But a community assessment consists of structure, population, and a social system, and you usually will assess in that order. So first the structure, first the population, and then the social system. And I'm going to talk briefly about each of those. So first the structure. So what is a structure of a community? Well, that could include the name of a community or neighborhood. It could be the geographical boundaries. It could be emergency services, water, sanitation, what kind of housing, the economic status, such as what is the average household income, number of residents that may be on public assistance, and then transportation. So that's all part of what we call a structure. So we're going to look at that first when we're assessing a community. Then we're going to go to the population. So what does the population look like? So what is the age distribution in the community or within that population? What is the sex distribution? How many males versus females? What are the growth trends in that community or population? What is the density, the education level of the people in that community and population? What are the predominant ethnic groups and religious groups? So that is assessing the population of a community. So first we assess the structure, then we assess the population, and then finally on the next slide here we have the social system. So structure, population, now social system. And we assess the social system, we're looking at the educational system, we're looking at the government within the community, we're looking at what types of communication systems they have, welfare systems, healthcare systems, volunteer programs. So those are all part of a social system. So again, I have another video about community health nursing. Again, I really would advise you to watch these videos. They really do add a lot to the lecture itself. So please take the time to watch that. So we've come to the end of our lecture, but I do have some practice questions that I would like to go through with you guys just to kind of review what we just talked about. Again, I know I would prefer to be actually talking to you guys in lecture one-on-one, going through this lecture with you, but with our Healthy People 2020 presentations, it's going to take up most of our class time. So I'm hoping that you get a lot more information out of listening to this versus just reading it. So let's go through the first question. So vulnerable populations of patients are those who are most likely to develop health problems as a result of, and your choices are chronic disease, homelessness and poverty, poverty and limits in access to healthcare services, lack of transportation, dependence on others for care and homelessness, excess risks, limits in access to healthcare services, and dependency on others for care. And again, if you'd like to pause, and once I read the question, you want to pause it, take a look at the answers, and then come back and listen, that's perfectly fine. But for the answer for that one would be D. So when we talk about vulnerable populations, those are the patients that are, or members of a community that have excess risks, limits in access to healthcare services, and they are dependent on others for care. So that is an example of a vulnerable population. Number 2, which of the following are major public health problems commonly affecting older adults? So we just talked about that. We talk about a population that is considered vulnerable as the older adults. So for this question, you could choose between substance abuse, confusional states, financial limitations, communicable diseases, and acute and chronic physical illnesses. So after looking at that one, your answers would be A, B, C, and E. So substance abuse, confusional states, financial difficulties, which we talked about, and acute and chronic physical illness, such as cancer, diabetes, arthritis, those types of things. And number 3, the nurse in a new community-based clinic is requested to complete a community assessment. What are the steps for completing this assessment? So you have the structure, social system, or population. And again, the way that you would assess that would be look up the structure, then you're going to look at the population, and the structure, the population, and then the social system. So A, C, and B. That would be the order you would put them in. So here are my references for that. Your textbook again talks a little bit about community health nursing, but I also did go into other resources to get you more information, because community health nursing is the future of nursing. We want to be able to treat our patients in the community and get them less, need for treatment within the hospital setting where it's more expensive. So let me know if you have any questions. Otherwise, I will see you guys in class. Have a good day. Thanks.